All right, we're going to get started. Welcome everyone to the Climate Change and Public Health State Seminar. Could somebody please chat into the question bar to let me know that you can see the slides and hear me okay? Great, thank you all. Wonderful. So Sergio and Teresa down the LA region have been working hard for the last couple of months putting this webinar together. So thank you both so much for taking the time to facilitate this. So I'm going to pass it over to Sergio and Teresa and let them give their introductions and kick off the webinar. If you have any questions at all during the session, please chat them in the question bar on the side, and I will send them along to our facilitators. So please continue to use the question bar. And now I will pass it over to Teresa and Sergio. Thank you both so much.
Thank you. Hi, guys. To this month's state seminar. So Sergio and I have been working at the LA County Department of Public Health. And while we've been here, we've learned the major health impacts of climate change and also how to develop mitigation and adaptation plans from a public health perspective. So the objectives of the seminar are to understand the health impacts of climate change and how to communicate the issue through a public health lens. And at the end of the seminar, we're going to try something a little different where we'll have an interactive component where we'll ask you guys to submit a quick response on how your projects incorporate public health. So our first speaker is Dr. Linda Rudolph. She is the director of the Center for Climate Change and Public Health at the Public Health Institute. She also served as deputy director for the Chronic Disease Prevention and Health Promotion at the California Department of Public Health, and has also served as health officer / public health director for the city of Berkeley and chief medical officer for Medi-Cal Managed Care. Linda?
Hi, thank you so much, Sergio and Teresa, for inviting me to participate in this. I know that the work that you're doing with LA County Department of Public Health is really exciting, and I'm very excited about being able to share a general overview about climate change and health with all of the other CivicSpark workers so that you too can start thinking about how to integrate public health into the work that you are doing. So, there we go. So, just to provide a little bit of context, one of the things that's really exciting in public health is that the human population is healthier than it's ever been before. If you just look globally, life expectancy is increased, poverty is decreased, child mortality is decreased. So all over the world, there's lots of good news about the health of populations. But a recent report from the Lancet Commission on planetary health basically said, yes, that's great, but to achieve this improvement in global population health, we've exploited the planet at an unprecedented rate, and that in the long run, damaging the planet damages human health. So we've increased our water use unsustainably. We've cut down tropical rainforests unsustainably. We're using fertilizer at an unsustainable rate. Our energy use, as you know, is producing carbon dioxide emissions. So, I want to just make sure that we think about climate change in the context of all these other environmental impacts that we're having. We would have air pollution, we have air pollution and climate change. We have water contamination and climate change. We have problems with topsoil depletion. So these other things that are happening are sort of the context in which climate change is happening. And climate change is just one of 9 planetary boundaries that we are close to crossing, all of which impact human health. So that's just a really broad context for talking about why we think climate change is the defining health issue of our time, and why, in fact, it's an existential, literally an existential threat to humanity, because it threatens our air, our food, our water, our shelter, and our security. There's been a lot of recent reports that really document the nature of the impacts on climate change on health, and I'm only going to have time to really run through these quite quickly, but these reports, should you be interested, provide a lot more information than we'll share today. So you all are extremely familiar with how our human activities, how we move around and transport ourselves by car and truck and plane, what we eat, particularly meat, how we light and heat and cool our homes using fossil fuels, and the amount we consume all contribute to greenhouse gas emissions, and that those greenhouse gas emissions have basically 5 global climate impacts, which are warming, ocean acidification, glacier and snow melt loss, sea level rise, and changes in the Earth's water cycle, hydrologic variability, which really is what creates the increase in the frequency of extreme storms and precipitation and changes in drought around the world. And those global climate impacts cause local climate impacts that we experience in the form of loss of snow in the Sierras or coastal flooding associated with sea level rise and storm surge, or drought or wildfires or extreme weather events or extreme heat events. And we know that those climate risks vary from place to place, which is why so many of the different communities in California are doing climate vulnerability assessments, and why at the state level the Cal Adapt program is trying to help local governments really understand what the climate forecasts are for their particular neighborhoods. In Los Angeles, as you know, we're going to see more extreme heat days, more wildfires, increases in the average temperature. It's these local climate impacts that have impacts on the environment, and the environment, both physical and social and economic, that then lead to health impacts. So the warming temperatures of the ocean increase the risks of more harmful algal blooms. And in fact, this last year, we had one of the worst harmful algal blooms ever on the Pacific coast that resulted in shutting down fisheries in Washington, Oregon, and Northern California. You know, it's heat and extreme weather events that cause declines in crop yield, changes in temperature and in precipitation, change where mosquitoes and other disease-carrying vectors like mosquitoes, ticks, live, changes in water temperature and air temperature, also the rate at which microbes that can cause water or foodborne illness multiply. And we know that there's impacts that result in conflict over resources. So when there's less water or less food, there's more likely to be conflict around those resources. And also the economic impacts, for example, that we saw in the Central Valley with the loss of jobs due to the drought. So that's really the pathways, and there's many of them, through which we see the impacts of climate on health, which range from these direct impacts like injuries or drownings from extreme weather events and flooding, or heat-related illnesses and deaths during extreme heat events, to impacts like air pollution that I'll talk about momentarily, allergic disease, infectious disease, food insecurity and malnutrition, water insecurity, and then, as I mentioned, displacement, conflict, and migration. And all of these are associated with stress and mental health impacts. So I want to just quickly walk through a few examples of how interrelated these different health impacts are, and talk first about heat. Heat's the leading weather-related cause of death, and heat also has all these other impacts besides those that we see with extreme heat events. Just to give you a sense of the magnitude of extreme heat event impacts, California had a heat wave in 2006 that caused around 655 excess deaths. Earlier last year, there were thousands of deaths in Pakistan during a heat wave. In Europe in 2003, there was over 70,000 deaths during the summer heat wave that was prolonged and really impacted most of Europe. So we don't think about heat as being a killer very often, but it really can have profound impacts. A couple of weeks ago, we were on the phone with a health department in Arizona, in Tucson, where they had, despite a lot of efforts to notify people and work with the sheriffs and so on, they had 5 heat-related deaths over a weekend with a very early heat wave that people really hadn't been anticipating. But heat also causes increases in ozone levels, which is one of the primary contributors to smog and air pollution that then impacts asthma, heart disease, and other respiratory disease. It increases the risks of wildfires, which then expose people to wildfire smoke that has a lot of toxic contaminants and particulate matter that also impact heart disease and lung disease. And the plumes from wildfire smokes can really carry for thousands of miles. Heat can cause crop yield declines that then contribute to food insecurity, which in itself relates to increased risk for chronic diseases like obesity and hypertension and diabetes. Warmer temperatures increase pollen counts and also increase the length of the pollen season. So in some areas of the country already, the pollen season is about 3 weeks longer than it used to be. And heat is worst in urban heat islands, where the lack of trees and the density of buildings and pavements can make the temperatures up to 22 degrees Fahrenheit higher than in the surrounding areas. Heat also exacerbates drought. And you all know that California is still in the worst drought in its history. And drought has a variety of impacts on health. Obviously, just in case you forgot, we all need water to live. So drought decreases access to safe drinking water. It also decreases water quality. So if you have a body of water that's contaminated with toxic chemicals from fertilizer overutilization, like we have all over the Central Valley, where we have a lot of water contamination with nitrates, or from sewage spills or dairy manure that spills into water, those concentrations of toxics will be increased as the amount of water in any water body is decreased. Because of its impact on food production, drought decreases the availability of cheaper food and increases food prices, leading to food insecurity. I mentioned wildfire. Drought also increases dust in the air, and in California we've had an epidemic of valley fever that in part is related to dust. So, and also in the drought, sort of paradoxically, we saw an increase in West Nile virus because the drought prevented the flushing out of sewer systems, and a lot of stagnant water pools were left in the sewer systems that provided ideal places for mosquitoes to breed. So in the Central Valley, thousands of people actually had their taps run dry as their wells went dry because of the drought. And the local health departments there had to set up systems for distributing bottled water to people, setting up water stations where people could fill jugs with water. They set up community showers in some places, so really had very significant effects. I've talked a little bit about the relationship between climate change and vector-borne disease, and a good example of how serious this can be is the Zika virus epidemic that, as you know, we're now starting to see endemic, meaning locally spread cases of Zika in Florida. And it's certain that that will continue to spread into new places. California just got about $700,000 to track this because we already have the vector, the Aedes aegypti mosquito that carries Zika virus in many counties in California. And this is a new phenomenon related to changes in California's temperature and precipitation patterns. So a couple of more impacts on food that I haven't mentioned. Heat and drought impact livestock production, and also pests make it harder to control pests because a lot of pests really like warmer climates. And some people are concerned about what that will do to the use of pesticides and herbicides on crops. So there's so many impacts on food that many public health folks feel that in the long run, this is going to be one of the most important considerations in terms of the impacts on the global population of climate change. And then I mentioned conflict, but we also know that millions and millions of people are going to be displaced as they lose the ability to farm in Central America due to drought, or in Southeast Asia due to the incursion of salt water into areas where they're trying to grow rice, and then ultimately due to sea level rise itself. So what makes people and communities more or less able to thrive even in the face of climate change? Basically, we know that health status impacts this a lot. Obviously, if you've got asthma and you're exposed to higher levels of ozone, or you're exposed to wildfire smoke, you're more at risk of an asthma exacerbation. And if you've already got prior heart disease, you're more impacted as well. People that already have diabetes are at higher risk of the impacts of food insecurity and rising food prices. But in addition to health status, we know that really it's the social determinants of health that most impact vulnerability to climate change. So people that are living in low-income communities, people that don't have good housing infrastructure, for example, that don't have screens on their houses to keep out mosquitoes, people that don't have access to transportation to evacuate in case of a storm, people who have to work outside, people that are living in air-polluted areas where the rising ozone levels are exacerbated, people that don't have social connections that can help them when they're facing the need to evacuate or they're struggling with not having enough food. These are all things that contribute to vulnerability. And we know that these are really the same things that create the health inequities that we already see in every part of California and the nation, where the physical, social, economic, and services environments that people live in aren't equal across different neighborhoods. We have some great neighborhoods and some neighborhoods that are less desirable because they have less parks, more traffic, more fast food and liquor outlets. You know, and it tends to be people of color that live in those neighborhoods, just like it tends to be people of color who work in the lowest wage, hardest physical labor jobs like farm work, and so on. And I'm not going to have time to go into this, but really we see this sort of final pathway for these health inequities in the form of differences, very significant differences in life expectancy, even within the same city. So the difference in life expectancy for a black child born in West Oakland versus a white child born in the Oakland Hills is about 6 or 7 years. We see it in asthma rates. We see it in pollution levels being unequally distributed. And we know that so this social injustice is having a huge impact on people in California, in the U.S., and around the world. And it is directly related to the impacts of climate change on health, our living conditions, the existing health inequities, and these other environmental impacts I started with, all are the key impacts, all are the key inputs into vulnerability and resilience to climate change, and thus key factors in creating what my colleagues Rachel Morello-Frosch and Manuel Pastor have called the climate gap. So people of color and low-income communities are the most vulnerable to the health impacts of climate change. And, you know, we can map that as Paul English at the Department of Public Health has done by looking at heat vulnerability, and you can see here neighborhoods in San Francisco where there's fewer people that have good housing structure, there's less trees, there's less parks, there's more buildings, there's more pavement. And we see the same thing looking at a whole variety of outcomes. If you look at Fresno County on the upper right, or at Los Angeles County on the other three graphs, that really show how low-income people and people of color are more likely to live in neighborhoods that have characteristics that make them vulnerable to the health impacts of climate change. These climate injustices aren't just local, they're also global, and we can talk more in the discussion about some of the intergenerational justice issues where, although we're already experiencing the impacts of climate change on our health now, it's our children and grandchildren who will experience them even more unless we get a move on changing things really quickly. So I'm not going to talk about how the health system itself is impacted. We know that hospitals aren't fully prepared yet for the full impacts of climate change, but just to summarize, on the impact side, this comes from the Lancet Commission on Climate Change and Health. Climate change is potentially catastrophic for human survival, and it constitutes a medical emergency. To safeguard human health, we have to maintain the health of the planet on which we depend, and that really means addressing climate change. The great thing is that responding to climate change is also a great health opportunity. Why is that? It's because the same systems, our agriculture, energy, transportation, building, and consumption systems that are causing climate change and other environmental degradation are also causing great health inequities. So if we address those systems, we will both reduce climate change, reduce other environmental pollution, and improve health. So we know that clean energy and energy efficiency are super important strategies for reducing greenhouse gas emissions, but they also reduce air pollution and its related asthma, respiratory disease, cardiovascular disease, and adverse birth outcomes. And we can reduce fuel poverty by implementing energy efficiency and clean energy in ways that are equitable and rely on distributed energy systems with some community control. Unfortunately, the EPA Clean Power Plant, which is a super important federal proposal to reduce air pollution and greenhouse gas emissions from power plants, especially coal-fired power plants, is on hold due to challenges in the Supreme Court from Republican governors and Republican attorney generals. We know that if we move to zero emission and low emission vehicles and more fuel efficient vehicles, we'll reduce air pollution. But what a lot of people haven't thought about is just how important it is to reduce vehicle miles traveled through active transportation, walking, biking, and public transit. That's probably the place where we can see the most important health benefits from a climate change strategy, and work done by the California Department of Public Health suggests that in the Southern California region, if we just increased walking from 4 minutes to 19 minutes a day for purposes of getting to where we need to get for school and work and so on, we'd reduce cardiovascular disease and diabetes by 12%. And we'd also reduce dementia, breast cancer, colon cancer. But we have to make sure we don't risk increasing injuries and fatalities from pedestrian and bicycle crashes by really doing everything that we can to implement safe walking and biking infrastructure. Our food systems. Probably the most important thing that we can do is stop eating so much meat, because livestock production is one of the major sources of methane, which is one of the short-lived climate pollutants or super pollutants that has a global warming potential much higher than that of CO2. So if we can reduce methane and other short-lived climate pollutants like black carbon and the fluorinated gases, we could essentially buy time for the kinds of transformations in our energy and transportation systems that will be needed to reduce CO2. But there's a lot of other health benefits of creating more sustainable food systems, reducing pesticide use, reducing antibiotic use, which is causing antibiotic resistance, and increasing access to affordable, healthy food that also goes a long way toward reducing chronic diseases like obesity, cancer, heart disease, and diabetes. Right now, we waste about 40% of the food that we produce in the U.S., and that food waste alone contributes to about 20% of our methane emissions. So if we institute programs to divert edible food waste from institutions to food banks, we could significantly decrease food insecurity in California as well. And then there's benefits of urban greening, which reduces our risks of heat illness, increases our access to healthy food if we plant community gardens, reduces the risks of stormwater runoff and flooding, and provides places for people to be active and reduces energy costs if we use shading efficiently. So just to recap, climate change is affecting our health and well-being now. A majority of physicians in 3 surveys of physicians say they are seeing these impacts in their patients. It threatens our air, water, food, shelter, and security. It acts as a threat multiplier for many of our existing health challenges. It disproportionately impacts people of color and low-income communities, so it exacerbates health inequities. And we know that climate actions have big health co-benefits, and that if we act to reduce greenhouse gas emissions in the right way, we can also really create healthier, more equitable and more climate resilient communities. So I will stop there. I encourage anyone who's interested in this to join the U.S. Climate and Health Alliance, and thank you again for being able to talk to you. And I'm going to change, who should I give the presenter rights to?
I can actually, I think that Elizabeth is going to be our next presenter. So
okay. I will make Elizabeth the presenter.
Great. Thank you so much.
I think we're going to have a short Q&A session just right now to answer some questions that Linda can answer, if that's okay, Kristen?
Yeah, that sounds excellent.
Okay, Linda, we had a couple questions come in. One about the health impacts related to heat. What does death by heat exactly mean? Is death caused by dehydration, heat stroke?
Yes, it's caused by, when people cannot, when their bodies aren't able to sweat properly, or they've sweated too much, and then they can get, start with a heat rash, and then that progresses on to heat stroke. And basically your body just can't function once it's had too high an elevation of temperature. So yes, the deaths are from heat stroke.
Okay.
But let me just clarify that, associated with elevated temperatures are all of these other issues as well. So actually many of the direct heat deaths are associated with stroke, but many of the excess deaths that occur during a heat wave occur because people that have renal insufficiency go into renal failure, people that have heart disease have heart attacks. So there's a variety of prior existing chronic diseases that are exacerbated in heat that lead to the excess deaths that we see in these heat waves, in addition to the more direct heat stroke route.
Okay. Our next question is, what would you say is the most important factor for climate and health resilient communities?
Well, I believe that a healthy community is a climate resilient community. So a community that has a healthy population, we'd go a long way to increasing climate resilience if we reduce chronic disease rates. And that requires reducing air pollution, increasing access to green space, having access to healthy foods, having healthy energy systems that aren't producing air pollution, and I don't think there's a single factor. I think that they're all really important. But I think if we pay attention to having access to healthy foods, having access to healthy transportation options and places for safe physical activity, and reducing air pollution, we'd be a long ways toward both healthier communities and addressing climate change. And of course, we want all of those things to really address the inequities in the distribution of those social determinants of health I talked about too. We don't want those benefits just going to wealthy white people.
Okay, the next question is, what are the most important steps for local policymakers to take to begin reducing the climate gap in vulnerable areas?
The first thing we need to do is make sure that we're really investing in low-income communities. Many low-income communities have worse infrastructure than wealthier communities, and so I think investing in infrastructure to make sure that we've got good sewer and water systems all over the state, which we don't, so that people don't run out of water in a drought and they don't get flooded when there's heavy precipitation in other areas. I think investing in biking and walking infrastructure, especially also providing shade and making sure that it's safe, is really, really important. And investing in making sure that every community has access to healthy, sustainably produced food and to green space, because green space really has all these benefits. So those are all things that people can do at a local level. LA is a leader in many of these things, and I think Elizabeth might talk about some of the things that LA Health Department is helping to do toward that end. But bike and walk infrastructure and parks and green space and urban forestry, urban tree planting, and reducing food waste, these are all things that local governments can take on, as well as renewable energy incentives.
The next question is, how would you tackle the challenge of newly planted trees in urban areas not being able to grow properly due to water weathers and not being able to provide shade or cool down temperatures as a result?
I may defer to Elizabeth to answer that question, because she's been working hard on some of related issues. But when you talk with the urban forestry folks, they feel that this is a challenge, but that it's a challenge that we can meet by paying really careful attention to what kind of trees we plant and how we take care of them. So, we need to be paying attention to the drought tolerance of trees, to creating infrastructure that allows us to water them enough but not overwater them, and to thinking about using our water wisely so that we are not wasting water on other things, so that we can, in fact, create the tree canopy that we know is going to be ever more important in face of a warming climate.
Okay. And our last question is, in the previous litany of problems facing the world, which one or two do you view as needing to be addressed in the immediate term?
Climate, these are, we have a lot of challenges, and that's why it's so exciting to me that you all are engaging in CivicSpark and, learning about and being and really working on these problems from so many different perspectives. But I chose amongst all of these to work on climate change because public health really focuses on the prevention of disease and illness. And I look at climate change as something that we can prevent the most dire consequences of, but only if we act very, very quickly. So we know that we have a carbon budget, a total amount of carbon or greenhouse gas emissions that we can dump into the atmosphere before we just bake in a certain amount of temperature increase that may have associated impacts on tipping points, like the melting of the Greenland ice sheets or the melting of the permafrost. And we know that if we keep emitting greenhouse gas emissions at the rate that we're emitting them right this minute, that we're going to basically use up that carbon budget within the next 6 to 10 years, depending on what your target is for total warming, whether you want to try and stay below 2 degrees or what most people now agree is a safer limit of 1 to 0.5 degrees Celsius rise in temperature. So we have a very, very short window of time in which we can prevent catastrophic climate change. And that's why I personally feel that it's really incumbent on all of us to treat climate change like a health emergency and mobilize as quickly as we can to make changes that are feasible and have health benefits to reduce those greenhouse gas emissions now.
Great, thank you, Linda. And now I'll pass it on to Sergio to introduce Elizabeth.
Hello, everyone. I just wanted to say thank you, Linda, very much for your very informative presentation on the impacts of climate change on public health. And to keep the discussion going in the same vein, now it is my honor and pleasure to introduce our next speaker, who is also our CivicSpark supervisor here at the Los Angeles County Department of Public Health, Dr. Elizabeth Rhoades. Dr. Rhoades coordinates climate change policy and programs at the LA County Department of Public Health. And she works to bring a public health voice to decision-making related to climate change. She is the department representative to county and regional climate change work groups. She founded and leads the Interdepartmental County Climate Committee, which brings together various LA County departments to implement the county's Community Climate Action Plan. In 2014, she authored 2 climate change reports released by the Department of Public Health entitled Your Health and Climate Change and Framework for Addressing Climate Change. Dr. Rhoades received her doctorate in public health from the Johns Hopkins Bloomberg School of Public Health. The floor is all yours, Elizabeth.
Okay, thanks, Sergio. Can everyone hear me? So Linda talked really eloquently about climate change as the defining public health issue of our time, and she talked about heat and air pollution and wildfires and all of the other reasons that we should care about climate change as a public health issue, and care about climate change because it's a public health issue. And so in this presentation, I wanted to delve even more into how we communicate about climate change through a public health lens, and why framing climate change in the context of health, as Linda did, is so powerful and effective. And let me see, there we go. So I'll be talking about, I think, to understand communicating climate change, it's helpful to understand how the public actually perceives climate change. So we'll talk a little bit about that, talk about framing climate change in a public health context, and then I'll briefly discuss some of the things we're doing at the LA County Department of Public Health on climate change, and specifically Teresa and Sergio's projects that relate to different aspects of climate change. So the Yale Project on Climate Communication is this great ongoing project that looks at people's opinions about climate change around the country. So what you can see in this map is the response to the question, do you think global warming is happening? Anything in orange is a more than half of people in that particular county. It's broken out by county. So more than half of the people in that county agree with a statement that global warming is happening. Anything blue is less than half of people agree with that statement. So you'll actually see that almost all of the map, right, almost all of the counties in the United States have most of their population believing that global warming is happening. There are a few, you know, in Utah and some places in the Midwest, but in most counties in the U.S., the majority of the population actually believes that global warming is happening. Now if we move on to ask people whether they think global warming is mostly caused by human activities, you have less agreement. Only about 48% of the public in the U.S. actually agrees with that statement. So again, you have a lot of agreement and sort of along both coasts, but then a lot less agreement with that statement in sort of the interior of the country. So we're getting to less and less agreement. Now you ask people, how do you think global warming will harm future generations? And again, amazingly, 61% of the population actually agrees that global warming will harm future generations. Again, the majority of people in most counties believe that that climate change is going to be harming future generations. Now you ask them if it's going to harm people in developing countries. So we're getting kind of more and more immediate with our questions. Future generations is a little bit distant. People in developing countries is still fairly distant, a little less so, and you have a little less agreement with that question. So a little more than half of the country thinks that global warming is going to harm people in developing countries. Then you ask the public whether global warming will harm people in the US. And again, you have slightly less agreement with that statement. Now we're asking people, do you think global warming will harm other people in the US? Not themselves, it's not personal yet, but just vaguely other people. But still, more than half of the population, again, looking back through our slides, we see a lot of people think global warming will harm future generations, more than 60%. More than 50% think it will harm people in developing countries, again, fairly distant. Still more than half think that it's going to harm other people in the US. Then you ask people whether they think that global warming will harm them personally. And there are almost no counties, I think there are no counties in the United States where the majority of the population actually thinks that climate change is going to harm them personally. Only 34% of the general population actually thinks that climate change is going to harm them personally. So I think that's a really interesting finding because it partly speaks to why we may be having trouble getting people to care about climate change, because they believe that it's somewhat distant and it's not going to affect them or their families personally. And in case you're interested in the breakdown in LA County specifically, which is of course where I work, we're doing a little better than the rest of the country, as you would expect. Nearly 70% believe that global warming is happening, and 45% think it will harm them personally, which is a lot higher than the national average, but still less than half of the county. I also want to get a little bit into how this plays out when you talk about race, because I often think, and we get some opinions about how perhaps low-income and minority populations perhaps don't have the time, the resources, or whatever to care about climate change, to support climate action, that somehow this is kind of outside of what those populations can really focus on. And I've heard some presentations given which talk about Maslow's hierarchy of needs, for example, where if you don't have your kind of basic needs, how can you care about broader issues like the environment and justice issues? But the data actually show that those assertions are completely false, that actually low-income communities and communities of color are much, much more concerned about climate change and supportive of climate change policy than white communities and affluent communities. And I think that speaks to, I think there are probably various reasons for that, including that a lot of what Linda talked about, that the systems that cause inequities are the same systems that cause climate change, that people in these communities are more affected by the impacts of climate change. They're less able to adapt to those impacts and much more concerned about them. And contrary to what we see a lot in the news, where it seems like, again, like a lot of people maybe don't believe in climate change or don't support government action on climate change, the research actually shows that a large majority of Americans support government action on climate change, both nationally and at a global level. So again, this kind of gap in people thinking about the fact that they believe that climate change is going to affect others, that's going to affect future generations, it's going to affect people in developing countries and maybe other people in the US, but it's not going to affect them, really speaks to how we need to be messaging about climate change, and we need to be making it personal. So I love this quote that says, one side argues morality and polar bears, and the other side argues jobs. You're never going to win with polar bears, right? So a lot of the messaging that we've been hearing about climate change historically has focused a lot on polar bears and melting ice caps and ecological issues. And that's concerning, and I think people find it sad, but it's not personal, it's not relatable, it's not immediate to people. So how do we make climate change immediate to people? And that's where I think public health, again, is so important. Research has actually shown that framing climate change with a public health focus was the most effective way to talk about climate change to get people to care about it, to get people to support policies for climate mitigation and adaptation. And you see that conversation, and Linda's really been leading that conversation in a lot of ways. You see that happening at various levels. Even on the national stage, the White House has really started to talk a lot more about climate change from a health perspective, with the president relating his daughter's asthma to the imperative to talk about or to take action on climate change. He talked about wildfires and air particulates in the air. He talked about asthma, of course, and allergies. So really, and he talked about it as a public health and a safety issue. So really seeing a change in the way the conversation is being framed. And I think another really effective way to bring that home to people is not just to talk about health impacts in general, but to talk about local health impacts. Again, ways to make it immediate so that people start to understand and respond differently to that question about whether they think climate change might harm them personally. So Linda had this map in one of her slides in her presentation. And this is research that came out of UCLA in 2012, looking at projections for the number of extreme heat days. And I use this a lot in my climate change presentations because it allows people to look at their neighborhood and see how much heat is predicted in their neighborhood by the middle of the century and how that might impact them. And then I, of course, follow that up by talking along the same lines as Linda did about how heat is a public health issue, not just in terms of direct heat-related illness and death, but also the ways that heat stresses the body, causes more emergency room visits and hospitalizations for cardiovascular issues, diabetes, kidney disease, and just overall, even if you don't have those severe impacts, overall affects people's quality of life, your ability to go outside and exercise, all of those issues. So again, making it local. This is a photo of the Sand Fire, which was a few weeks ago in LA County. We had a huge fire in the Angeles National Forest, and it spread ash. We were getting ash raining 50 miles away from the fire at our workplace. Huge air quality issues, lots of attention, I think, paid to those air quality issues, people having to stay inside, people's asthma being triggered. And there needs to be, again, more of a conversation tying these kinds of events to drought, to climate change. I think, again, bringing it home to people to see that these impacts are immediate to them, their local impacts, and their impacts to their health and well-being and that of their families. It's also important, though, not to simply be alarmist and kind of and not give people positive solutions. So I always like to talk about how solutions to climate change, as Linda talked about, are really these no-regret options that serve to create healthier, more resilient, more equitable communities overall. So when you're improving public transit to reduce greenhouse gas emissions, that's allowing people to, to get to their workplaces better, and it's improving air quality, quality of life, all of those issues. So everything that we're doing with climate change, and we'll talk a little bit more about that in some of the later slides, really are things that we should be doing anyway to create healthy and sustainable communities. And that's how we want to message those things. So we always want to conclude, our public health warnings with positive solutions, like Linda did. So really, health is a compelling lens with which to talk about climate change. And then from our perspective, working at a local health department, we're really on the front lines of trying to protect the public from those health impacts of climate change. So that brings me very briefly into what we're doing at the Department of Public Health on climate change. In 2014, we reduced our 5-point plan to reduce the health, or we released our 5-point plan to reduce the health impacts of climate change. And that has 5 strategic priority areas around informing and engaging the general public around climate change, and promoting, planning, land use, transportation, water, and energy policies that reduce greenhouse gas emissions. So that's our mitigation component, working with other decision makers on the level of policy, programs out in the community to promote climate mitigation. Providing guidance on climate preparedness, so that's our adaptation side, again, working externally to promote adaptation. And then internally, building the capacity of our own departmental staff and programs to engage with climate change. And because change really should begin at home, adopting best management practices to reduce greenhouse gas emissions associated with our own facilities and operations. That same year, we released a couple of reports on climate change that outline the public health impacts of climate change and talk about how to work with other sectors like public works, other county departments, public works, regional planning, parks and recreation, to collaborate on climate change solutions. We have a web page that highlights some of the materials that we've developed, including our plan and our reports and our internal workshop series that we use to educate our own staff on climate change. So one of the projects that we're working on that is Sergio's project is the Urban Heat Island Reduction Plan. So in the County Climate Committee, we're working with, of course we lead it, we're working with Public Works, Planning, Parks and Rec, Fire, Beaches and Harbors, and our Internal Services Department to create a plan that reduces the urban heat island through 4 major strategy areas, which are expanding and maintaining the urban forest, increasing green space, promoting cool roofs, and cool and permeable pavements. And then Teresa's project, as I'm sure many of you know, also is the Climate and Health Initiative. So while the Urban Heat Island Reduction Plan focuses on working with other county departments, so external partners outside of our department, the Climate and Health Initiative is internally focused on the Department of Public Health to create a self-sustaining work culture within the department that encourages, recognizes, and organizes climate change work. So we have one of the largest health departments in the country. We have 4,000 staff. Our responsibility is all 10 million residents of LA County. And that means we have a lot of opportunities if we leverage all of the capacity in the department to work together on engaging with climate change issues and preparing for climate change and protecting the public from the impacts of climate change. We have a huge potential to impact change in that area and getting organized through this initiative. So we developed this logic model, which basically goes through some of our early outputs being developing or convening a work group of county staff and setting goals pursuant to our 5-point plan, and then implementing those goals by first creating very concise action plans to meet those goals. So those goals keep our 5-point plan moving forward by proactively continuing to identify objectives that meet those different priority areas that we've identified under the 5-point plan. And ideally, or ultimately, the impacts that we want to have is reducing the public health risks associated with climate change, and then again, overall, healthier, more resilient, more equitable communities. So I'm happy to take any questions.
All right. Thank you very much, Elizabeth. And we do have a few questions, some that are also coming up for Linda. So if you're still on the line, Linda, I would be happy to answer some of the questions coming up as well. That would really help. All right. So the first question I think came out of the last, I think, well, it can be directed toward both of you. Oh, I guess actually we'll go back to the one question regarding trees that Linda sort of wanted to defer to you, Elizabeth, about how do we tackle the challenge of newly planted trees in urban areas not being able to grow properly due to warmer weathers and not being able to provide shade or cool down temperatures as a result?
Yeah, so I think, Linda, you gave a great answer to that already. So I would just reiterate the importance of selecting the right tree species, which is something that various county departments in LA have guidance around. We're particularly focused on drought-tolerant trees that also provide some shade, and then of course departments like Public Works have additional requirements such as trees that don't rip up the sidewalks. So it is kind of a challenge because various departments have their recommended tree lists, and one of the goals that we have is to reconcile some of those. We also have a lot of opportunities actually for growing trees in one of our detention centers run by the Sheriff's Department. There's actually a nursery that grows trees, and they've been very open to getting input from our tree committee, which is sort of a sister committee to our climate committee that's working on the urban heat island reduction plan. They're very open to getting recommendations on the types of trees that they should be planting. And then in addition to planting the right kinds of trees, I think trying to think about using the right water source to water those trees is also really important. So wherever recycled water can be used, that's really important. And then I think also educating people, particularly the public, about the fact that especially after trees are established, they don't require as much water as many people think they do. So we do try to really focus on making sure that people maintain their existing trees if they've stopped watering their lawn to still water their trees, because trees have such important health benefits for all kinds of reasons, the urban heat island just being one of those.
All right, next question is for both of you. Is there more need for professionals addressing climate change and public health at the international or national scale, or also at the state and local government scale? So.
Yes. Linda, did you want to talk? Did you have any comments on the international scale?
Yeah, actually, the U.S. Climate and Health Alliance that I mentioned is the U.S. affiliate of the Global Climate and Health Alliance, which includes organizations like ours or networks of health professionals from many countries, mainly developed countries that are working on climate change. But there really has been an increasing interest and awareness of this issue internationally. The World Health Organization just had its second conference on global climate change and health last month, and the health community was quite active at the Paris talks. They had there was a full-day climate change and health conference organized by the Global Climate and Health Alliance and the World Health Organization at the Paris talks. But there's a lot more room for action, and although the federal government here did just put out a very good report through the Global Climate Research Program on the health impacts of climate change, the health community in the U.S. as a whole, I would say, is not as engaged on this issue as it ought to be and needs to be. In other places, there's a lot of emphasis right now in the health community on reducing the use of coal because it has such severe climate and health impacts. But there's definitely a lot of room for movement in this arena.
Yeah, I definitely agree with all of that, and you know, I'm a permanent staff person working at a local health department on climate change as my main focus, but that's a real rarity. So health departments, especially smaller health departments, often don't have as much capacity to do a lot around this issue. So definitely more resources are needed to help local health departments with their capacity to work on climate change.
All right, and I guess to continue the sort of same discussion, one of our questions is what types of jobs exist in working with climate change and public health, and is grad school usually required?
So there's, as far as I can tell, and Elizabeth may have a different, some additional thoughts on this, there are a few jobs, but not very many, like Elizabeth has in local health departments. We're working with local health departments in 13 different cities around the country, and all of them have staff that are working on climate change. And then there's jobs in sort of public health organizations like the Public Health Institute where I work, although we don't have a lot of funding, so we don't have very many jobs. Our jobs basically do require a master's in public health. And then there's jobs that often don't require graduate school in environmental justice organizations that are working at the intersection of climate change and health, and in other advocacy organizations that understand what Elizabeth talked about so clearly about the need to integrate the personal and health consequences of climate change into climate communications. So I would see those as sort of the three currently available pathways.
Yeah, I would agree with all that, and like Linda said, the necessity of having a graduate degree depends on where you're hoping to be employed, and typically if you're looking to a local health department, it does help to have a master's in a related field, like a master's of public health.
All right, that was a great question. Whoever submitted that, I think most of us in CivicSpark are sort of wondering the same things. The next question, which can be answered by both of you, is how much of an effect do you expect green infrastructure to have on reducing climate change effects? So for example, if we replace 50% of current infrastructure with green infrastructure, how much it reduces overall effects by X% of, and so that's sort of how the question ends.
I mean, I think that it's all going to depend on your specific area and whatever modeling is done. It's very difficult to model exactly how how different, for example, tree planting or cool roofs in an area, particularly in coastal areas, how that may impact local climates. In LA, for example, we have really a lot of microclimates. We have our coastal breezes, and so it does make it challenging to model the exact impacts. But we do know that implementing green infrastructure aggressively can have very positive effects, both in terms of a mitigation perspective, but also in terms of simply cooling neighborhoods. And cooling buildings and providing shaded places for people to walk to transit or be out in the park but be in the shade, and that has positive implications for public health in terms of people being able to go about their daily activities, people experiencing less heat stress, so direct heat-related illness, and less exacerbating existing medical conditions.
All right. Would you like to add on to that, Linda?
Nope, I think that was a great answer.
All right. Thank you. So the next question, kind of hitting on the point that you talked about, Elizabeth, regarding Maslow's hierarchy of needs, is how can the hierarchy of needs apply to one's ability to do something about climate change rather than their perception of the issue? If that makes sense. Sorry.
So the question is whether people who don't have basic needs met might not be able to advocate around certain issues. Is that
Yes.
okay?
Yeah.
Well, I mean, I certainly think that that it's more challenging when people are struggling to subsist, to find time to be able to advocate for these things. But you see tons of advocacy organizations and climate justice organizations where people are heavily involved. So I think when people find things that are important to them and they're committed to them, I think it's really important to honor those communities and what they're working for, because these are the people who are most impacted. They've contributed the least to climate change. People in developed countries who are low income have contributed the least, and people in developing countries have contributed the least. It's affluent people in developing countries who have created, you know, the most greenhouse gas emissions, who are the people who are causing climate change. So I think the point was mostly that that really it's important not to patronize these communities by assuming that they don't have the sort of the space to care about this issue and that they don't have interest in advocating for it. So to counter that. But yes, of course, it can be a challenge, and I think, you know, lack of political influence and financial resources oftentimes means that advocacy from these communities doesn't receive the attention that it should.
All right. Thank you very much. Linda, do you also have anything to say?
Nope, that was great.
All right. So that was the last question submitted so far, but we still have one more component to this webinar that is something that we'd like to try differently. So we'd like to ask everyone just 2 questions. All right. So we just quickly like to ask all the fellows who are still on the line to answer these two questions, how does your project incorporate public health? And how can you further the goals of your project to include public health? If you can just submit your questions, or I'm sorry, your responses to this in 1 to 2 sentences on your question box in the GoToWebinar menu, and then I will be receiving those, and we will ask for our 2 speakers to provide any input to those. And later on, we'll be sending the rest of the responses we get and their feedback too. So if we can take at least 2 minutes, 2 to 3 minutes to answer those, and then whichever ones come our way, we'll quickly start responding to those. All right, so we've got one so far. And so it says, my volunteer project is the aspect of my work that is most related to public health in implementing the Bay Area Idle-Free program to reduce vehicle idling at local stations. By informing the public on GHG reduction goals and progress, residents are more aware of climate action issues. In an indirect way, this could increase interest and awareness of public health related to climate change. So the first two, or this first one seems to be related to transit. Elizabeth or Linda, if you have any feedback.
It sounds like you're working on getting people that are driving to not idle their cars when they're filling up for gas. Is that correct?
Yes, I think so.
Okay, that's a great project, and it clearly does incorporate public health already because it reduces the air pollution that also is increased when people are idling. I guess it would be great if there was a way to figure out how to also talk with people about whether or not they're filling up their gas more frequently than they need to because they're making short trips by car instead of trying to walk and bike for the short trips where walking and biking would be feasible.
Great, thank you. Elizabeth, do you have anything to add to that?
No, I think Linda covered it. Like she said, you can emphasize the local health benefits of not having people idle in your neighborhood. That you can have better air quality if you don't let people idle their vehicles near where you live and work.
Mm-hmm. And that's also something that here in the county we're looking at, and we're also looking to reduce, at least from a municipal aspect, the idling of county vehicles and equipment. So that's actually a great project and something that seems to that other jurisdictions in California are looking at as well. So the next statement. So this one is, some of our adaptation initiatives include addressing public health impacts, such as setting up emergency centers for extreme events and cooling centers during heat events. Any feedback on that from our speakers?
That's great. Where is that person located? Where are you located?
Unfortunately, we're not able to see that right now, but I don't know if there's any way of sort of looking at that one. Another one also.
Can I say something about cooling centers? And I think that's great. And again, obviously, that's really directly related to reducing the health impacts of climate change. I don't know what kind of cooling centers you're establishing. A lot of local health departments are recognizing that the most effective way to establish cooling centers is to do it in a place that people already are coming rather than setting up some new place. But there's also a lot of questions about, you know, who's actually using cooling centers, who knows about them, how to make sure that there's also outreach to people that don't have good transportation or that are homebound, or socially isolated people who are really at amongst the highest risk of heat illness. And then making sure that efforts to do an adequate emergency response to heat are integrated with efforts like the one that Elizabeth talked about of reducing the urban heat island so that the cumulative total risk for population is reduced by cooling the city as well as preparing to respond to extreme heat.
All right, thank you, Linda. And that also came from our fellows in the North Coast, actually. So great work on the cooling, on informing about cooling centers during heat events over there. Is there anything you'd like to add, Elizabeth?
No, that was great. I think Linda really covered it.
All right. One more, another statement to highlight. The Central Coast works on energy efficiency, which helps with the reduction of greenhouse gases. As we reduce greenhouse gas emissions and air pollution, we contribute to the reduction of health problems caused by air quality. We can frame energy efficiency as a public health benefit for our communities.
That's great. So I think that's great. Two thoughts about energy efficiency. And I don't know whether you're working on building retrofits and weatherization as energy efficiency or on sort of the appliance side or something else. But I think energy efficiency is one of those areas where we really, really need to think about making sure that it's equitable and that low-income people have the same access to taking steps to reduce their use of energy as wealthier people do. So, you know, we do have programs that allow low-income people to benefit from home weatherization and retrofits, but we need to make sure people really know that they have access to those programs and that they're adequately funded to you know, meet the demand of a more informed public. And then the other thing is that we have to make sure that when people are doing energy and retrofits and weatherization in buildings, that they know how to do it safely and in a way that doesn't have any unintended consequences in terms of indoor air pollution.
Great. Thank you, Linda. And then another statement also is coming from our fellow in Emeryville. Her project is to develop the climate action plan for the city, and it requires consideration of public health impacts of climate change. And one way of furthering the goals of that project is to educate affluent people on both their impact as well as their ability to influence for the better of the world and the city of Emeryville. Any feedback on that?
I really go ahead, Linda.
Go ahead, Elizabeth.
No, I mean, I think that's great because I think oftentimes we see outreach to communities and education about mitigation activities happening in very low income and vulnerable communities, and the people who really need to be changing their habits are the wealthy people. You know, the huge water users are not in low income communities in LA. They're in Beverly Hills, they're in Brentwood, they're in Malibu, and it's those people who need to be changing their behaviors to reduce greenhouse gas emissions and in general conserve resources. So I think that's a great component.
Great. So we have several more, but I think with the time running out, we'll cut the presentation there. But again, we will be sending out these statements back to you all with feedback. What we really like to thank you all for participating. Hopefully this was fun and something new to do.
Yeah, thank you everyone for participating, and we'll also be sending out additional resources about public health and climate change if any of you guys are interested. And if you have any other questions, you can go ahead and email them to Sergio and I, and we'll forward them to Elizabeth and Linda.
And lastly, we'd like to thank our two speakers for joining us in doing this presentation and in teaching us more about climate change and public health.
Thank you very much. And thank you to all of the CivicSparks for the work that you're doing.
All right. Kristen?
That's it. Thank you everyone again for joining and sending so many awesome questions and project comments. All this is recorded, so we'll be sharing that probably later. But thank you to Sergio and Teresa for doing a great job facilitating today. I really appreciate the help. All right, thanks and goodbye everyone.